I lived it. Lived it alone, lived it in pain, lived it in depression, lived it in hurt, lived it in fear, lived it and learned, lived it and came out of it, lived it and conquered it, lived it and defeated it, lived it and looked victorious in it. I lived it. I'm HIV positive.
I think one of the major factors with HIV and AIDS in the Black community is that it's still there. If you look at the national numbers, Black men and Black women today still represent the greatest number of new infections of HIV and AIDS.
According to the CDC, 50% of my community, so Black men who have sex with men, are living with HIV.
The group that has the fastest rates of diagnosis in the United States is Black women, cisgender women who are contracting and or living with HIV at the same rate or even higher rates than Black gay men.
And we look at trans people, trans men, a community for which there's incredibly low amounts of data. We see that trans men are falling further behind than their cis counterparts. And then when we look at trans women, and more specifically Black trans women, depending on where you are in the country, about 62% of Black transgender women will have an HIV diagnosis in her lifetime.
That is pandemic level, and it is something that is not really talked about that much publicly.
A person who's Black in the United States of America has a greater likelihood of facing any number of disparities.
Everything from poverty to lack of education, access to education and gainful employment, housing.
Racism, sexism, homophobia, transphobia, police brutality, stigma, discrimination, and all of those factors place barriers.
All these issues intersect, and it's not like we can just sort of pick and choose, or we can turn things on, turn things off.
And so you couple that trauma on top of, and you need to practice safe sex, and you need to take PrEP. It's a lot.
If we don't address the fact that people don't have a place to lay their head, they don't have food, like if we don't address those things, then we cannot move closer to ending the HIV epidemic. And I think that's our biggest challenge.
To a national observance for World AIDS Day 2021. Each year, World AIDS Day brings people together to continue the fight against HIV/AIDS, as well as to show support for the people living with HIV and to commemorate the lives of those who we have lost. We welcome you to this discussion with my esteemed panel, who is here to provide some insights about the impact of HIV/AIDS in the Black community. Thank you all for joining us. And in the 40 years since the first cases of AIDS were reported, Black Americans and communities of color have been disproportionately impacted by AIDS. By 1993, HIV was the leading cause of death for Black men between the ages of 25 and 44. And by 2004, HIV became the leading cause of death for Black women in the same age group. Today, Black Americans still account for a higher proportion of new diagnoses and people living with HIV compared to other races and ethnicities. These statistics need to change. They have to change for us to end the epidemic in our country. They are changing, and our group of panelists are on the ground leading the work and the efforts to make this change possible. And so with that, I'd like to turn it over to my panel to introduce themselves and briefly share with us why they are so committed to addressing HIV/AIDS in the Black community. And we'll start with Tony.
Good morning, everyone. My name is Tony Newman. I'm the interim CEO for the Black AIDS Institute here in Los Angeles, California. I recently joined, and the reason I joined them, because for 23 years, they've been fighting to end the HIV/AIDS virus in the Black and Brown community. And I'm glad to take over this because personally, I've been fighting this disease for 10 years in the trans community, which is the community that I'm a part of. That community of trans women of color are hit very hard, as well as women of color. And I'm here to represent them and help find an end to the HIV/AIDS virus.
Thank you, Tony. And now, Bishop Osea Allen.
I'm Bishop Osea Allen. I'm the senior pastor of the Vision Cathedral of Atlanta. We have locations in Nashville, Los Angeles, and Raleigh, North Carolina. I am also the executive director of the Vision Community Foundation. Most importantly, I am a Black man. I am a same-gender loving Black man. And that drives my passion for this work, particularly as a pastor. I've said this all over the country that I had found myself doing so many eulogies, so many funerals and counseling so many families, particularly as it related to young Black gay men who were either a part of my church or a part of the community. And I took the torch, as so many people, and particularly this panel has done. And so I remain passionate. I'm passionate about this conversation, and I appreciate being a part of it.
And next we have Rev Dr Shonda Jones from Wake Forest University School of Divinity.
I am Shonda Jones. I am the principal investigator and founder of the Faith Coordinating Center at Wake Forest University School of Divinity in Winston-Salem, North Carolina. We are deeply committed to advancing the work of addressing HIV and AIDS among faith communities. And for so many years, I have been involved with much like Bishop Allen said, walking alongside people who've experienced tremendous loss as a result of this virus. So my energy, my compassion, and my activism has been related to those who've been impacted by HIV and AIDS over the last 40 years.
And again, my name is Dr. Chanel McGoy, and I am a director in public affairs, corporate citizenship at Gilead Sciences. Let's get right into the discussion. With 40 years into the epidemic, we are in a unique time to both reflect on the past and see the promise of the future for HIV/AIDS epidemic in Black communities. What are some of your earliest memories of the impact of HIV/AIDS on Black communities? And I'll start with Bishop Allen.
My first memory really is when I was very young. I grew up in the church. I am a son of the church, particularly the Pentecostal church. I also have roots in the Black Seventh-day Adventist tradition. And what was fascinating is that particularly during the late 80s, I began to notice that we had people in the community, or the religious community, that were quietly getting sick, quietly either being funeralized or being handled or talked about in a very mysterious way. The traditions that I grew up in weren't as demonstrative as our Pentecostal settings as they are now in terms of talking about homosexuality or talking about HIV or talking about some of these issues. It was really quiet. And then I started to lose personal friends of mine who worked in ministry, and no one was talking about it. And, just based on my personality, I had a lot of questions. My family wasn't talking, my church family wasn't talking. And so I guess started to journey into an awareness of my own self and how that awareness around my own sexuality and my faith and those intersections were reflected in the transitions of these people who were passing and the impact of HIV in particular in the faith community that I was in. Of course, years later, as a result of becoming a senior pastor, particularly within our community, the Black LGBTQI community, it made sense that I would have to be on the forefront of this, which created a lot of tension because I didn't understand why a lot of Black clergy and churches weren't on this issue. The Black church has, quote unquote, been the pioneers of social justice movements in this country, particularly as it relates to civil rights. But I didn't understand why there were many clergy like myself who felt alone in the work. But I used it as fuel to continue to do the work. But I guess in some way, it always connects to my earliest experiences with people who I loved, who I lost.
I think as we talk about 40 years into the epidemic, I think of it as a relay race and that baton being handed off. So there are so many people who spoke out early. There was silence, yes, of course, but there were some change agents, some pioneers, some people who spoke about HIV, talked about acceptance, and were loving and caring. Particularly, there were some in the church and in other communities that impacted the Black community around HIV/AIDS. And so I wanted to turn to Tony and say, can you call those names? Can you call the name of someone early in the epidemic who was a trailblazer? Because we want to honor and respect and remember those who were working before us to get us to this point where we are now, to begin to move the work forward as we hand it off to others.
It was about 30 years ago that I began my transition into the transgender community. And it was at that time I was noticing that a lot of trans women of color were dying. The focus was on gay men, but the trans women were at a high percentages of getting sick and dying, not going to the doctor. This is not a famous name, but there was a young woman who's still living named Caprice Carthens, who's a health educator, was like a mother to me 30 years ago. She was telling each and every one of us to go get tested, to do what is necessary. And she's still living, bless her soul. And I remember that day that she came out and then had me to spread that word as well, out on 14th Street. And if you're not familiar, 14th Street 30 years ago was hot and popping with trans women of color doing survival work, trying to live their authentic life. I had just been let go from a company with 2 degrees and was unable to get a job myself. So I faced some hardships, and she came in with knowledge and power to tell us that we needed to get tested and to take care of ourselves. So that is a trailblazer that is living and living in Chicago. I give kudos to her. And I do whatever I can today to support her in any way I can for that. And the trans community has been hit hard, even 40 years ago, even today. I always say that we are the lowest on the totem pole in the LGBTQ arena. And I still find that true today.
And Reverend Dr. Shonda Jones, can you provide a reflection and call a name of someone who did this work before you and is a trailblazer and pioneer that maybe we don't know the person's name? Maybe it's not somebody famous or who's had the opportunity to share on large stages about their experience in HIV.
I think about the names of folks like Pranissa Seal, who started the Balm in Gilead many, many years ago, and how we incorporated important liturgies and rituals in our congregations at the height of the epidemic. I think about Rev Ed Sanders in Nashville, who has been a champion for those of us who've been impacted by HIV and AIDS, and a truth teller. So I really appreciate you taking a moment for us to look back in order for us to kind of know where we're going, right? That these pioneers for us really laid the groundwork for us to be able to do the work that we're doing 40 years later.
And I know Bishop has some fond remarks around Reverend Sanders and his work that he's been doing. He's special to you.
Yes, yes. He's been a spiritual father. I call him my pastor, but really has been my guide. You know, all of us who do this work, as was just mentioned, we're doing it on somebody's shoulders. And, you know, we are here because somebody had the courage at a very difficult time raise their voice and to fight back. Many unknown, many known, but particularly in the Black church, it has been complicated to find those names that have really been doing the work. As you said a minute ago, which I think was really great to say, there have been many in the church for 40 years who have been trailblazers. They may be church mothers. They may be working health ministries in the church. They may be pastors for who have been doing this work for years that, you know, a lot of times when we talk about HIV in the Black church, it is a complicated conversation. And sometimes we forget that there have been people on the front row of this work for as long as HIV has been here. And so I really appreciate you raising. I do want to add 2 names to this list. I know you said one name, but of course, Rev Ed Sanders, but I want to just raise Bishop Carl Bean and Bishop Yvette Flunder. Bishop Carl Bean, who has transitioned with the Unity, you know, he created the Unity Fellowship, really, which was undergirded by the Minority AIDS Project in LA, that was really about HIV and providing HIV services to our community. I want to raise his name. And then, of course, Bishop Flunder, who has been on the ground doing this work for many, 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 many years, who I see as a spiritual mother. I wanted to raise those 2 names.
You know, 40 years later, we are still dealing with the stigma, the silence, discrimination, and shame directed at Black LGBTQI people living with HIV, that intersectionality that exists among race, status. And so what are the ways that our cultural icons can better support Black LGBTQIA and HIV communities? And why is that so important? And I'll turn to Tony for this question.
I would love to see our church leaders do more testing at the church. The church is very important. I go to a church myself every Sunday. If we could get our church leaders, I was grew up as a Pentecostal Christian who shunned me and told me I was unworthy in so many things. So I found my own spirituality through my own prayers and direct relationship with God. But I would love to see the Black church. Let's do more testing, outreach, and education. Not only about HIV and AIDS, but about syphilis, gonorrhea, and COVID. I think the church could play a major role. Our pastors are put up sometimes in a high level. And when they speak and say do, the church will act and do in most cases. So I would love to see the church leaders and the faith leaders step up and do more testing at the church, invite health educators to the church to do testing in the outside and in the symposium. I would love to see more of that so that we could educate our Black and brown sisters and brothers about all of these things and just make sure that they are healthy and doing okay, and then give them linkage to care if that is what is needed. And BAI is happy to come to your church in Los Angeles. We will be glad to show up on a Sunday with the team and do the testing. So not only am I asking, I'm offering the services free of cost to any churches in the Los Angeles County, San Diego, wherever you are in California. Let's get this thing done.
Thank you. And turning to Rev Dr. Jones, can you share with us what ways cultural icons can better support Black LGBTQIA and HIV communities? And, you know, I think about cultural icons being our faith leaders as well.
You know, I think of cultural icons and I think of the need for them to be inclusive ambassadors for liberation, hope, healing, and change. Being willing to have open conversations about Black health and Black sexuality, and to discuss strategies that lead to positive health outcomes. And, you know, thinking about faith leaders in particular as cultural icons, and the powerful witness that we have of the Black church enacting change in communities. I think we really have got to do some work in getting people to examine their limited interpretations of scripture and sacred texts, their narrow theologies that paralyze us from being able to do effective work in responding communities related to HIV. So I think there's an opportunity for cultural icons, whether that be faith leaders or rappers or athletes who have influence in the community, I feel like they can join us, join the Black community to support the rights of LGBTQ persons and those living with HIV, and to recognize the sacred worth of all God's people. So I think there's opportunity for that. And I think that calling to their, giving them a challenge to sort of rise into this place of influence in a way that's really instructional and helpful to those people who really need them.
And I don't know if you all saw on social media, I recently saw a post by Magic Johnson talking about, commemorating or talking about the day that he found out that he was HIV positive. I recently saw that and thought how powerful it was of a statement for him to make about his journey over the last decades that he has been living with HIV. So, I think of him as a cultural icon who has in many ways transformed the image, the idea of what HIV has done to a person living with HIV, but also the impacts on a family structure around HIV. And so I'll turn to Bishop now.
Well, first of all, I, for the obvious reason that they have influence on how we think, they have influence on what we think about, they have influence on when we think about these things. Collaboration is the new currency. You can't do anything without, that was good, wasn't it? That was a sermon.
Yes, that's tweetable. It is tweetable.
Tweetable. We have to collaborate to get the work done. Now, having said that, I would say that I see something very fascinating happening that I think is like a revolution around conversations about the LGBT community, TQI community, about inclusion, about diversity. Even when you think about Lil Nas X and even the beef with him and Bootsy. I'm always troubled on the surface when there is infighting with us. But I will also say what's fascinating, the more people have these social commentaries and conversations, it forces the conversation to the front. Even if you take a different side than me, in some way, we're talking about, it's like, when you talk about marriage equality, no one was talking about it, 40 years ago. And so they started talking about it. And even people that were like, I don't support it. After you infuse it and infuse the social discourse with the conversation, it becomes the norm. And so I think in a way I am seeing, when I just listened to the T.S. Madison interview on the Breakfast Club. I don't know if you've heard about it, but a trans woman of her caliber, Black trans woman of her caliber, having a conversation about Dave Chappelle's show. And I think in a way, all of these things are creating the environment that we want. And that is at the, on a very surface level. I think it's layered and there are issues that we need to talk about, but we're talking about it. When I was growing up, people were not talking. The church was not talking. Pastors were not talking. I mean, they were talking, screaming, hollering, but they weren't talking. And so I appreciate in some way the social discourse that is happening, that is forcing us to contend with some of these conversations that we were not.
And the beauty of social media is that it allows these conversations to be amplified and for diverging voices to join in. And so you can see how the conversation has evolved in many ways over the course of, months with Lil Nas X and Bootsy. And it's just amazing to both call in folks and to challenge thought and to challenge language and words and to challenge the discrimination and to be a part of that and to see it evolving in a way that wouldn't have happened, 20, 30 years ago. Rev Dr. Jones, do you want to share?
Actually, I think Bishop did a fine job on that one. I think that it's so true, like thinking about the engagement that happens, no matter which side of the fence you end up on, that bringing divergent views together is what education is all about, is what development is all about. And absent from that, the silence is what kills us, right? So I think that sort of creating these different pathways where conversation can be had to be able to lift up community leaders and have them to engage in things that they were not engaged in even 10 years ago, I think is going to help us in addressing HIV and AIDS in the South in particular.
Yes. And so you bring me to the impact of HIV/AIDS in the South. And Gilead has a 10-year, $100 million commitment to address HIV in the Southern U.S. called the Gilead Compass Initiative. And this work is now in its 4th year and has really partnered with organizations, grassroots, frontlines, as well as academic institutions and nonprofits, multi-sectoral approaches to address HIV in the Southern U.S. And so given the barriers and challenges to ending HIV/AIDS in the Southern U.S., and we understand that the literature tells us that there are challenges around the shame, around the stigma, there are policy implications around HIV and AIDS, as well as cultural impacts. And so how do we effectively equip and empower people living in the Southern U.S. to address HIV/AIDS? And when I talk about people, I also think about Black communities, family structures and networks, social organizations, our sororities, our fraternities, our service organizations, as well as the LGBTQ plus community. And I'll turn to Tony to answer that question.
You know, I'm from North Carolina originally, Jacksonville, North Carolina, a small town. When the AIDS virus first came out, it was very prevalent since there was a Marine base there as well of people who tested positive for AIDS. So that is a very, very, very thought-provoking question on how do we help our brothers and sisters in the South. And I think outreach, we are now, BAI is based in Atlanta and other Southern cities. I think outreach is what's needed in order to, and some of the nonprofits, there are not that many nonprofits in North Carolina that really cater to the African-American and Brown and Black community in service to AIDS. So more organizations like BAI and other organizations, I think, in the South that are primarily geared towards educating, enlightening, and outreach is what's needed in our Southern communities. And once again, I asked our Southern pastors and church leaders to step up again to provide leadership for their parishioners concerning their health. HIV/AIDS is a healthcare matter. It's a disease, but it's a healthcare matter, just like COVID and any other thing. We need to start in the church, where the Southern states are very heavily rooted in the church, whether it's Methodist, Presbyterian, Catholic. Pentecost is very relevant in North Carolina. We need their input and their help in order to increase, maintain, and educate our Black and Brown brothers and sisters.
Yes, yeah. And I'll turn to Rev Dr. Jones again and ask the question around how do we equip and empower people living in the Southern U.S. to address HIV? And can you address this from a particular perspective? When we talk about faith communities and our young people who often feel that they're disconnected from the traditional means of and ways of faith and are finding new ways to engage in their own spirituality and connect in faith.
Knowledge is power, right? So with the Faith Coordinating Center at Wake Forest, we have been joining partners across the South to help us address this issue. We've also, and to raise awareness and thinking about people who have moved away from traditional faith communities, right? Where they don't find hospitality or welcome necessarily in the church. We are meeting them where they are, right? So we're meeting them on Instagram Live. We're meeting them on Twitter. We're meeting them on Facebook. We are going to where they are. So if they have communities that are gathering in coffee shops or in places where they're having wind downs, that's where we're going. And we're inviting our partners, our funded partners, to help us with that work. I will say that Bishop Allen is on this panel, And his leadership with the Vision Foundation as one of our funded partners through the Faith Coordinating Center is an example of exactly the kind of things that we need to be doing in the South to really, really empower individuals and communities, those who are in the four walls of the church and those who are not. And, you know, one last thing I'll say is that I feel like in Southern communities in particular, that when you hear people talk about you equal you, that movement related to undetectable equals untransmittable, it's really difficult for Black people who are unable to sort of address some of the systemic issues related to having a low viral load, like access to meds, inability to stay compliant with their medication regimens and things like that, that I think our partners in the South, right, through faith communities, through faith-based organizations, we're building a network of individuals and organizations that can really help us dig deep, right? So we're thinking about work that is deep and wide, and that also creates alternative ways to reach people who have a spirituality, they have a faith, but you may not find them in any Presbyterian or Pentecostal church through these Southern states, right? So I'm teeing this up for Bishop because I really do think that the kind of partnership that we're doing through the Faith Coordinating Center provides an example of how to effectively equip and empower persons in the South in positive ways.
Yes, yes. Take it away, Bishop. I know you're ready.
Thank you, Reverend Dr. Jones. I appreciated you raising those ideas and issues. I will say, I think, first of all, we have to, there are multiple ways that we have to see this work. HIV is a social justice issue. And so when we're talking about our social justice movements, not only do we have to be at the social justice tables, we have to make sure that social justice activists that are fighting in other genres of the movement are at our table. You know, it's a social justice table. It's not an HIV table. It's not an LGBTQI table. It's not a Black Lives Matter table. Like, we have to be a part of the Black Lives Matter movement strategy, period. Like, you know, as they say, you know, period. Like that just has to be if we are going to be a holistic movement as a people addressing our issues. That's the first thing I will say. That is one of the things that I think will help to address that I don't think we have fully actualized. I think also we have to, there was a political slogan here in the city with the mayoral race here, and it's this notion of reimagining. And so we are in 40 years later, there was no Snapchat or Instagram or Facebook 40 years ago, just like Dr. Jones said. You know, we have to meet people where they are, understanding that we have to be innovative. When we talk about HIV, we have to be innovative sometimes. And I would say, this is just my observation, that a lot of times when we're having this conversation, particularly when we're talking about faith communities, there's no innovation in it. It's almost like, and I hate to say this, I pastor a church, it's like the church fan. It's like the church fan. You know, there was a time that's all we had was the church fan from the funeral home. You know, we have air conditioners, we have HVAC systems now. You know, the world has changed. We have different ways of addressing the same thing. And so we have to be really innovative. The last thing I would say, and this is why I appreciate Wake Forest, Dr. Jones, and this initiative, particularly around faith, because there are a lot of affirming spaces in the Black community that have begun to develop and emerge that are on the ground, you know, that have created the safe spaces for Black trans folk, for Black gay men, for bisexual folks, for sexual minorities, if you will, quote unquote. They're already doing the work. HIV positive and negative people and people who are on medication and treatment, trying to get in treatment, they are in the space. And so there has to be a way that we're also seeing those spaces as critical. When we talk about the Black church, we're not just talking about the mega church down the street. We have to also talk about the spaces that, and they may not be necessarily quote unquote LGBTQI affirming, quote unquote. They might just be a more inclusive space that we have to find a way to reach.
This is my new church fan. My church fan has, although I love the old church fans, I have a new one that I'd like to carry with me when I worship. One of us is not free unless all of us are free. I can't separate my identities. And, I just look forward to the impact that these new folks, these young folks who are coming up and talking about HIV in bold ways and connecting the dots across what freedom and what justice looks like for all of us and the work that they're doing. And so, one more question around how do we harness that powerful activism that addresses not only HIV, but other issues that are impacting the Black community in a meaningful way to address healthcare as a whole, to address the crisis along the continuum in Black communities.
I think hiring some Black and brown brilliant young folk to carry this work forward in that capacity is how we harness that, in my opinion.
Yes. And Reverend Dr. Jones?
I may give an unexpected answer, but what I'm thinking about right now is communal lament, right? That there seems to be in our communities this sort of emboldened individualism that is sort of taking hold. And I really feel like in order for us to move forward, that we need to lament, to cry out, to sort of have a starting place anew about where we are with this disease. Because I think far too often, too many people either are not taking it seriously, they don't even recognize that people are still testing positive for HIV, they're not taking preventive measures. So I feel like as a community, we need to lament. I'm thinking about in the book of Joel, how so many people like to quote that scripture that then afterwards, I will pour out my spirit on all flesh. Your sons and daughters will prophesy, your old ones will dream new dreams, and the young ones will see visions, right? We like to quote that. And people forget that before we get to that place in Joel, there was tremendous lament and crying out to the Lord, right? And crying out in anguish for the situation that we're in. And I kind of feel like in order for us to move forward, that in order for us to have healing to take place, that we must first lament, right? We have to lament before we can actually embark on this journey ahead by activating awareness programs and doing screenings. Like, I think all of those things need to happen. And I know this is a conceptual response, but I think it's so important for us to be able to harness the power from within, to be able to say what affects one of us affects all of us. And it grieves me, right, that we have brothers and sisters who don't have access to healthcare or to medication, that there are people able to take one pill a day now for HIV, and some people are still dying from HIV. Right, that there needs to be this sort of communal lament in order for there to be communal healing.
Oh, that was, that was the sermon. We just need to raise an offering for our organizations now.
Amen. Amen.
We had a text, and we had that was amazing. I would just echo Tony and Dr. Jones that eloquently laid it out. What came to mind was, if you look at social movements within the Black community, particularly as it relates to Black faith, it never started out with numbers. It never started out with mega congregations. As a matter of fact, you all know, you all are historians, Dr. King's letter was in Birmingham was written because there were a lot of clergy who weren't supporting him, and he still cried out. There were a few people that continued to lament. when you look at social movements and Black faith, when you look at, I would even raise Elijah Muhammad, that birthed, in a way, Malcolm X. Those were very small movements, Black faith movements in our community that became a focus for us as it relates to not just spirituality, but as I'm raising up the Nation of Islam, that focused on health. And so I only use them because I think if we're looking at Black health and we're looking at faith, that from my vantage point is a great example of how they collaborate and how they intersect and how it can work. Now, of course, we obviously have different theologies or perspectives, but I think at the end of the day, that sometimes is what gets in the way, is that we are focused on what we disagree on and not focused on what we agree on. And if we could just find a way to continue, or find a way to bring the voices that are even on this panel together, that come from different spaces together, then we're able to harness. We don't have to harness the numbers. We can simply harness the hope. We don't have to harness the numbers. We can harness the passion, Rosa Parks didn't have 70 people with her on the bus. She had her hope. She had her passion. She had her sense of courage. She knew who she was and made the decision that she made that was a part of a much larger way of moving a movement forward. So we have it. We can do it. It's right here. It's with us. Let's make it happen.
That was awesome. And so I thank you, my panelists, for joining me for this very important discussion around the impact of HIV/AIDS in the Black community for our 2021 National Observance of World AIDS Day. I thank you, Rev Dr Shonda Jones, Bishop Osea Allen, and Ms. Toni Newman. I thank you, all three of you. And we've come so far, and yet there's still work for us to do to address HIV/AIDS in the Black community. And 40 years into the epidemic, we've made a lot of progress. And I know together that we can continue to address HIV and AIDS, and for our people, for Black people, for Black communities, intersectionally, for all of us. And so I thank you for that. And we continue to recognize and commemorate the lives that we've lost, and we show support to people living in the US, the 1.2 million people living with HIV and AIDS, and we continue to fight against HIV and AIDS. And so thank you.
Thank you.
Thank you.
Thank you.